everyone, and welcome to another episode of Beauty Beyond Limits, a series where we explore the latest technologies and trends in the aesthetic and dermatology market. We're joined by a lot of professionals and some of the top and elites in the market, where they can give you a little insight on what to expect and what to look forward to. Today I'm joined again by my beautiful co-host, Ms. Racha.
Thank you, Hosni. Hi, everyone.
And we're also joined by the most talented doctor, the most trending doctor right now in the market, Dr. Mahmoud.
Thank you, Hosni, for having me. Thank you. It's an honor for me to be with you guys. So, Dr. Mahmoud Akrama, I'm aesthetic and laser specialist. And today, I think we have interesting topics to go over today, yeah?
We have very interesting topics to talk. Some of them which you'll be very familiar with, actually. And you're going to give some tips and tricks on what works and what doesn't. Mm-hmm. And let's see. I think the market is going to be very excited to see this. So stay tuned. It's about to get messy. Doctor, CO2 يعني تقريبا هو the talk of the market صح؟ المشكلة with the CO2 is everyone thinks it's like old technology. It's something that's outdated, بخوف, فيه كتير downtime, فيه كتير مشاكل. بس تقريبا كله لما نحكي مع أي dermatologist بالماركت أو أي دكتور بالماركت بيقول لنا جملة واحدة اللي هو CO2 is the most effective laser. It's just outdated. شو اللي تغير بالCO2؟
Let me make it simple for the audience. So basically, like CO2 is like if you have a derma clinic without CO2, you don't have it. And it's like essential thing. So basically, why? I make CO2 as basically having a car, and you make innovation in this car. So now, before we have the normal manual car, now we have electric car. Same thing for CO2 laser. So I believe nothing can replace the CO2 laser, because the innovation we have now in the CO2 laser machines is amazing. Now it's more customized. We can control the depth. Amazing. So basically, I see CO2 lasers is like we cannot replace it by another laser, but there is other treatments as well. We can combine it with it to make it best results.
100%.
Yeah.
CO2 is the godfather of all lasers, basically. So, doctor, بس في سؤال. Usually, the patients لما نفكر CO2 fractional as a treatment نتخوف دايما من downtime إذا كان لأن بيعتبروه as an aggressive treatment، ونتخوف كمان من side effects. إنه بيقولوا إنه أنا ما في إذا dark skin type وخاصة بهيك طقس. So doctor, في سؤال دايما لأنه البيشنتس دايما بس يفكروا CO2 fractional as a treatment بيتخوفوا من هيدا السيرفيس لأن for the long downtime من بعد السيشن وبلس من السايد إفكتس. يعني ممكن بيفكروا إنه ممكن definitely حيصير في عندي side effects خاصة مع الطقس ومع هيدا الجو. شو اللي تغير هلا CO2؟
The thing is, most of the people who are afraid from the CO2 is because of what they hear from the social media, from the doctors, from providers who are not capable to deliver the right treatment. So basically, especially here in the Gulf countries, because of the sun. So basically, people are always afraid from the CO2 laser. But now, especially with Tetra Pro machine, basically. Now there is a new technology behind it. There is a new technology. It's called basically the CoolPeel. Basically, it is a technology adapting the edge pulse technology, which is basically we are delivering high peak pulses within short intervals. So we are causing less thermal damage. So basically less downtime. So with less side effects.
Right.
And now actually we can treat that. Before when we freak out when we see a patient with skin type
5 or 6,
like we freak out. Yeah. But with the edge pulse technology now we can treat the type 6, type 5, and we're confident to deliver to the patient the treatment. So
with
basically
minimal downtime.
Exactly. Yeah. So it's a cutting-edge technology, and my patient actually in the clinic, they are traveling all over to come, especially
Really?
Imagine someone who traveled from Africa to
have
come
a
here
CO2.
to have CO2 and travel back. Yeah, because they feel
wow.
like more confident to do the treatment here. And let me tell you something as well. Like I have an example as well. One of my patients, so he's European, so he came to the clinic and basically he was afraid. Like he was literally, he took some painkillers like 1 day before, and he was like prepared for CO2 laser. And then when we started and we finished in less than 10 minutes, he was like, "Doctor, what you done? You sure you full?
You've done the full face.
The full face or what? Or you missed some point?" I don't know. I finished. It's like, okay, what other treatments I can do? Do it for me as well. You're amazing.
I have some free time. Please do for me some more. Okay. And he was like a dark skin type. You mentioned
he was European, so basically
European. Okay,
European.
I thought
So,
I'm coming from.
yeah. So basically now we are able to even now to deliver the treatment in less time, less than 10 minutes. We're full face. We're finished. So not only safety but efficacy and as well time effective. So yeah.
Hello. It has also to do a lot with the hand of the doctor, right? At the end of the day, mashallah. See, like a little bit, guys, you need to like do your research, but we're also tagging the doctor on the video. But the doctor has like some of the best results you've ever seen. You really have a waiting line sometimes to even like be able. So you guys have to hurry up. Yeah. He is kind of a celebrity. Yeah, he is kind of a celebrity right here. Dr. I wanted to ask you something. I know marketing نحن تقريبا بالميديا social media age now والmarketing everything's taking over صح؟ But sometimes people بيشوفوا كتير وبيسمعوا كتير أشياء but they can't believe it anymore because you know you're numb to the idea, right? We see like you know like the concept of this labubu and I don't know what's happening, right? Like it's like some weird things where you see it and it's interesting but you're like this is probably not like you know where like there's a lot of hype for no reason. Is it the same with this technology? Because like you're saying something that really has changed almost the concept بعقل الناس كلها, right? Which is basically a CO2 laser delivering the same power, the same energy, but with no downtime almost, and to like dark skin types. صرنا عم نحكي بأشياء very contradicting each other. Is it really what it is? Well, this is all just like a little bit too much marketing. Like we can be completely honest here.
So basically, now the CO2 laser now is like a machine. It's like you're having a Ferrari, and you can customize it. Basically, you can customize the I told you the H-pulse technology. The Tetra Pro is basically the only CO2 laser that has the Deca pulse, the H-pulse. Other machines that basically only the smart pulse. So this is what make it stands out
among other
devices. So we are talking about real technology in our hands, and we are talking about patient satisfaction. Now, before always like when other doctors as well, they are afraid from the CO2 laser. Tell me, doctor, how are you not afraid to deliver the CO2 laser? Yeah. You're in Gulf, like you're doing this. Say, yeah, and people like really they're waiting in lines to do the treatment, and it's not a hype. It's basically something real. We can see it in the and patient. They are basically some patients now they might think that okay, minimal downtime. That means no results. So it's So no, it's not like that. So basically, now we are delivering the same amount of energy, but basically in a safer way. So this is how basically we are reaching to the same effective results.
So I'm having at the end of the day, I'm having the same results.
Exactly. Yeah.
Different
but
energies.
even with the lower side effects.
But the same results يعني حأوصل اللي أنا بديه.
Before there was like there's some lasers are mainly for superficial resurfacing such as the Arabium YAG. It was mainly for superficial and the CO2 is mainly for the deep. But now we are doing the superficial, we're doing with the deep with the same machine. So this is it's a big investment for the clinic as well as for patient as well. Investing, I mean, to doing treatment to this machine as well as an investment for the skin.
Investing 100%. In your skin.
Yeah.
I like that. I like the invest in your skin.
Invest in your skin. Yes, 100%.
So, doctor, you mentioned the Arabium YAG, right? And we love like a competition. Everyone in the world likes to compare, right? It's not who's better, but what would you prefer, right? Like the Erbium YAG is something that in the last maybe 5 years, a lot of people have heard about in the market. But as the doctor you just mentioned right now, right? Erbium is more superficial. Maybe with the new CO₂, it's a little bit of both. How would you compare, or how would you distribute if you had both lasers?
So basically, both of these lasers, they are attracted to for the water and the skin. So basically, but Erbium YAG is more attracted to water. So basically, stay in superficial. Most of it absorbed in superficial layers. So that's why it stay on the superficial layers. Some doctors, they say like, okay, we can go a little bit more deeper with delivering more energy, but also more risks, more side effects. While in the CO₂ laser, we can go deeper without doing all this, like increasing the energy and we are more confident to do it because we know it's more controlled laser. So basically, we can control it more, especially with Tetra Pro. Now we can. With the different pulse technologies, we can control the treatment. We can control the outcome more and more. So definitely for me, I've tried many machines. Tetra Pro is like
Special
the
place.
best among the fractional
takes
lasers.
a piece of my heart.
Speaking
Special
of
place.
competitors, doctor, we have like other devices or other technologies that will treat, like, let's say, somehow the same indications of the CO₂ fractional, not exactly the same. One of the technologies is like microneedling radiofrequency. What is the difference between both? And why we would go for the CO₂ fractional or the Tetra Pro instead of going to microneedling radiofrequency? Does any of the technologies rule out the other, or we can combine it or use it both?
So basically, the CO₂ fractional laser, the Tetra Pro and the RF microneedling, somehow they are making the same thing, that the thermal damage or the thermal injury to the skin, and this basically that promoting the collagen remodeling and
the elastin.
Elastin as well. So, but the thing is, we have a wide range in CO₂ laser because we are doing resurfacing, so it will help us more in the scars. It will help us more. Let's say we want to remove the keloid and superficial pigmentations, the sunspots.
So I'm giving a new skin. Let's say I'm resurfacing, like giving a new baby skin to the.
It works much better. CO₂ laser works much better than the RF microneedling in terms for the scar treatment, especially the hard ones. The basically.
The one with fibrosis, let's say.
العنيدين شو
tenacious.
Stubborn.
Yeah.
Stubborn.
So the stubborn stubborn scars works much better. Now, actually, in my clinic, what I do sometimes, I do a combination therapy between the CO₂ laser and as well as RF microneedling. I give a little bit some time for the patient to heal from session to session. So in between the session of CO₂ laser, sometimes I do the RF microneedling to basically just to deliver like a better outcome as well for the patient.
Like in severe cases, let's say you can combine it.
Exactly,
harm.
Yeah. I believe the Tetra Pro as well has the dual wavelength as well. It has a radio frequency.
That's the dual glide. It has the CO₂ with the now Erbium glass, though.
The duoglide, not the Tetra.
But they have the C60.
SmartStack.
So they have the RF.
Okay. Dr. Mahmoud, there are some platforms that offer the CO₂ with the Erbium YAG, with the IPL, with a lot of technologies all in one.
Pizza maker.
Yes,
also, maybe,
exactly. Pizza with ananas. Let's say.
Coffee machine.
What do you think of these? They call it platforms. So what do you think of these devices? The platforms with a cocktail mix. كوكتيل شقف يعني.
So talking about chef and cocktail, I'm hungry a little bit. So you know, I trust the restaurants who deliver one meal. They're
Expert in one.
authentic. They give it to you really good. They take care of it. So I trust this. Talking about food,
Yeah.
and look, when we have one machine, so as Tetra Pro, the amount of innovation inside the machine, especially we're talking about CO₂ laser. We're not talking about
Any kind of
any
laser
kind of
or
laser.
technology.
So it should be very safe when the machine should be very safe. It should be customized. It should have the settings to play on. So the having one platform, having all the lasers same, it's bullshit. Yeah,
maybe I'm not giving the right energy, or maybe I'm not
And
targeting the right chromophore. Maybe
most of it, most of these platforms basically they're not effective. You can see the patient are coming one time after
paying,
one time,
investing without
for
any
nothing.
return.
Yes, and they end up with complications and stuff. So
The side effects.
always like go with the one machine that you trust.
You trust the doctor.
Yeah, of course you trust the doctor, and the doctor will choose that. Talking about a doctor now, because you know most of the patients now they just search about the treatment before you know
For
going to the
searching
doctor.
about.
So they come into the clinic to me and tell me, doctor, I want X treatment. I say like, why you choose X treatment? I say like, because I searched and I asked AI. They told me the ChatGPT told me like it is told me it's the best treatment in your case. I say like, really? I say yeah. And say like, what I'm doing here?
Let ChatGPT
Let ChatGPT treat you.
This is the new world. See, I saw a meme the other day, doctor. It was so funny. I found it. I saw someone is like, I have a headache, right? And then they went to Google, and then Google told them you're gonna die in 2 weeks. You have like cancer, HIV. You have 6 different things. Then he goes to YouTube, and then he spent the next 2 hours skipping ads to even reach the 10-second video. And then he goes to ChatGPT. It tells him everything in detail, but also doesn't give him the right answer. It tells him, by the end of the day, you can have one of 16,000 different things. So there's no real thing, and people are losing, I think, the touch with the humanity, right, anymore. Like,
yes, they're losing the trust in the healthcare providers. You know, is that the thing now? Okay, I will ask ChatGPT what's the best treatment, and then okay, I'll go for it. No. One time as well, one patient came to me and then he was like, I won't do facelift. I said, a non-surgical facelift and using threads. I said, okay. So we need like around 5, 3 here, 2 here, 3. So total 10 threads. So he was like, no, but I asked ChatGPT. He said like only 1 thread he can do for me.
Give us.
I was like, okay, it's a red flag. I said like, okay.
Please don't come back.
Go to ChatGPT clinic. Maybe they will have.
Yes.
Soon, maybe. You never know.
Doctor, one thing I wanted to speak. We spoke a lot about the CoolPeel technology, but I want to also talk about one thing about the Tetra, also the SmartStack. I've heard a lot about the SmartStack, right, and how the concept of it works. But for the normal person out there, can you explain it in like layman terms and simpler terms? What is SmartStack, and how does it improve your work, for example, in the clinic?
Yeah. So basically, you know, the SmartStack. It gives a little bit some intelligence to the CO₂ laser machine that basically, as I explained earlier, that we are delivering the high peak pulses with a short interval. So basically, to make it simple, instead of if we have a nail and we have like a floor and we want to nail, basically, instead of giving one very strong punch, this will destroy the surrounding as well. No, we are doing it more precise, more controlled, multiple times. So basically, we are avoiding the damage to the surrounding tissues. So this basically, it will end up in giving more controlled, more customized treatment, and with lower downtime and better outcomes. So it's amazing innovation, the SmartStack, and it makes our life easier. You know, the Tetra Pro before. Like we were choosing the patient to the treatment. Now we are choosing the parameters to each patient. This make a big difference.
So does stacking means I'm giving more energy to the skin leading to more damage, or how يعني if not, how did Tetra Pro handle this issue of more damage to the skin and more heat, more energy? How did Tetra Pro differentiate, positioned himself?
The thermal damage actually, and what causing basically the complications, basically when we have residual thermal damage like high, which basically it will irritate as well the other chromophores, such as the
melanocytes, you mean?
The melanocytes,
not the melanocyte level. That's why it leads to
So it will make ink or make hyperpigmentation. This we're afraid of.
Exactly.
So basically, there's other as well factors other than the stack as well. The density of the spot size. I mean, when we increase density, when we basically increase the space between the spot size, it will lower the risk of
hitting the melanocytes.
Exactly. So basically, it's not only about the stack as well, about the energy. It will as well about the density of the spot sizes. This all counts.
So
all like parameters, they work together in order.
Exactly.
Like what you said, it's basically very customizable.
Yes,
and it's
for each patient.
Smart. Okay, that's nice. That's nice. I wanted to ask you. So I'm gonna do like kind of quick fire questions, right? I'm gonna hit you with some. I'm gonna hit you with
Ready?
some indications.
we were having peace.
We were chilling before. Now no.
No. This will be a little bit more like dramatic, but I want to hit you with some indications, and I want you to tell me which one is basically responding better to treatments, and specifically, let's say in this case, the CO₂ or other treatments.
Okay.
So, ready?
Let's go.
All right. Pigmentation, pores, texture, and scars.
All of these?
Yeah. Which one responds better and which one responds less and less and less?
Okay. So basically, texture and scars respond amazing to the CO₂ fractional laser. Pigmentation depends if it was superficial or deep. Superficial, CO₂ laser is amazing to remove the freckles, the sun damage, the superficial, the sunspots. It's amazing work, amazing for the pigmentation. But for the deeper one, no, we need different treatment. Such as, the other lasers, such as pico laser, Q-switch laser. Yeah, so for pigmentation, it depends if it's superficial or deep. So yeah, the scar and texture, amazing.
I have a question. Personalized question.
Yeah.
Who cannot do the CO₂ fractional? Fractional laser, yeah. Who cannot do it?
So, talking about the skin types, we can do it for all the skin types, but unless if you have a problem with your skin, such as if you have rosacea, if you have eczema, psoriasis, and as well as if you are pregnant.
Yeah. But the rosacea, because I have rosacea, that's why I'm asking, because the CO₂ fractional is not the best for us.
It depends on your rosacea. So basically, if you are controlling your rosacea, I do have some patients, they do have rosacea, but controlled. We can do the CoolPeel. Gentle. Gentle one. So maybe you will have more downtime in terms of the redness.
Yes,
only the redness.
Yeah.
But in the end of the day, we can do it, but it should be done with a professional.
And professional, of course.
Yes.
Okay, so these are the main restrictions for the CO₂ fraction.
Yeah.
Okay, perfect.
Doctor, I wanted to ask you also, so now the way the world is moving, I feel like, especially in the world of aesthetics and dermatology, it's going towards an anti-aging route rather now than just like a fixing route, right? Like before it was a lot of, like you said, like threads, fillers, Botox. Everyone was trying to fix or trying to look like something. But even all the celebrities now, they're going towards using something like NAD, PRP, stem cells, like a lot of stem cells. And obviously when it comes to devices now, they're going towards like fractional devices, trying to look, they look 40 at 70, right? I don't know how they will look at 100, God forbid, I swear to God. But so when it comes to this kind of new age of medicine, let's call it, how does the CO₂ fit in? And in general, how do you see the patient's kind of recommendation? Like, what would you recommend to your patients who are coming in? Because I feel like now they see it, right? They saw, I don't know what's her name, Kim Kardashian's mother, right? She did it.
The usual.
Yeah, she looks 40 and she's like 70 something, and oh my god! And then she did like a lot of surgeries, but she probably did a lot of other things to also cover up the
Non-invasive,
surgeries. Exactly.
Yeah, because talking about surgical and non-surgical, there is some treatments like it should be done in a non-surgical way, such as for the skin and to improve the texture and to make it more thicker. And surgical is basically, there is some cases that we need the surgical. How the CO₂ laser fit in between the anti-aging treatments? It is basically it's a resurfacing and ablative laser. It's basically like giving new skin.
Yeah.
We're removing the old skin. We are stimulating the collagen. We are promoting the collagen remodeling. So, if someone who basically does not have scars or problem with texture, how often I recommend the CO₂ laser? I would recommend to do it at least once in a year, or twice in a year. It's really,
and with the CoolPeel,
it's a game
interrupt you,
changer.
with the CoolPeel, it's like a skin rejuvenation treatment, let's say, so they can do it for maintaining the...
Exactly. So basically, with the CoolPeel as well, we can do it more often.
More
The such treatment. I'll show you now, like before and after pictures. Here you can see like before and after picture. This is one of my patients who've been doing the CO₂ laser with me since 3 years, and you can see like the change in the texture. She's just going backwards. She's not moving forward. So like,
we're coming.
Yeah.
We're going.
Oh my god!
We're going.
Yeah, definitely.
Doctor, I have a question regarding the other indication of the CO₂. So we spoke about the acne scars, resurfacing of the skin. What other treatment I can use the CO₂ fractional for? Does we have other indications?
Yeah. So basically, I used a lot for tightening the eyelids. We are doing like non-surgical preferoplasty, let's say. But basically, of course, if we have excess skin, we can remove the skin but we can tighten the skin to an extent, and it's giving amazing results, especially for the eyelids. And as well as we can remove the moles, we can remove warts. We can basically there is actually now a specific handpiece called Tetra Pro. Basically, it is we can do it for like like complicated cases such as burns as well.
Nice.
So because it can penetrate more deeper. As well, it has I have a doctor working with me as well. She's a gynecologist. She's doing an amazing job as well with the CO₂ laser.
And the gynecologist.
Gynecology as well.
Really?
Wow.
Yeah. They can do as well. Like it has some surgical application as well. They can do labiaplasty.
Great.
Yeah.
So no need for surgeries anymore.
Yeah. I mean, it's amazing. It's like as you said, like it's a godfather for the lasers.
Yes.
The patient comes in, walks out, completely different person, head to toe.
I heard one more thing, that sometimes after the tattoo removal as well, whenever we finish the tattoo, we can use the CO₂ fractional.
Especially with the shadowing. After the tattoo.
Yeah, because the tattoo is not removed after all.
I have a friend who has this problem. I'm gonna send him to you.
Yeah.
Exactly.
He had a big tattoo here, and he removed it, but now it's all black now. Yeah, probably.
Yeah.
And it just looks weird now. It's just like if the tattoo was still there, it's better.
Yeah, we call it shadowing after the laser.
That's good. Makes sense.
Doctor, I want to ask you a question. A lot of these treatments really, the people say they changed their lives. Have you had an interaction where you felt like you've changed this patient's life?
Actually, I do have. Like, I had one young patient. She came to me. Her biggest insecurity is basically the acne scars, and she came to me. She was crying, and she came with her mother. She was like really desperate to do anything to help her. Yeah, and her friends always like bully her about how she look and about her scar marks and all that. I tell her like, give me time. It's with me. Don't worry. So basically, we did treatments for her over 6 months, and basically after we complete the all the session with CO2 laser, the way she changed, the way her skin changed is amazing. I'll show you here before and after now. And she came to me after 1 year, just recently. She came to me, doctor, I want to do the last session with you because I'm getting married, and now this changed my life, and you know, so
CO2 equal marriage. That's our branding now.
beauty marriage.
Get CO2.
plus Dr. Mahmoud equals marriage.
Right.
CO2 plus Dr. Mahmoud equals marriage. So if y'all are stuck in some situationship, you know where to go. Well
I'm
done.
coming.
Yeah.
Doctor, that was a pleasure. It was amazing to have you, honestly.
Thank you so much
I'm
for
really
all the
honored.
knowledge.
Yeah, and the insights. And genuinely, like, guys, if you have any questions, again, the doctor's Instagram will be linked in the bio and in the page also itself. So if you have any questions, you can go to him directly, but you can also visit him at his clinic, which will also be tagged. Doctor's one of the nicest and most helpful people you'll ever meet in your life. And I promise you, as he just mentioned with his story,
You will get a husband afterwards.
yeah, he'll change your life, guys. So thank you so much, Doctor. Do you have anything you want to say to the camera before we
Yeah,
final?
I'm really honored to be with you. Thank you for having
Thank
me
you.
today. And I've been working with you guys a long time, and really as well, you are one of the best companies
Thank you so much.
at taking care of their clients, and you know, delivering always the best technologies as well to our patients. So thank you.
Thank you.
so
Pleasure,
much. Yeah,
doctor.
yeah.
Thank you.
Thank you.